And welcome back to 23 ABC. Well, workers have faced a lot of uncertainty over the last 2 years, and in healthcare fields, that's never been more pronounced than now. The Biden administration's mandate that every worker in the field get vaccinated is putting nurses and others in the difficult position of choosing between their livelihood, their passion, and their bodies. Dan Grossman looks at the ramifications.
Ask most nurses what it is that drove them to their profession.
Bonding, that mother-child relationship was important to me.
And you'll likely hear something along the lines of what Jean Marie Naser has to say. She's wanted to do this since high school, when she cared for her bedridden mother. Years of autoimmune disorders led to a helplessness only Jean Marie could relieve until her mother died when she was 16. The calling wasn't something Jean Marie could shake or ignore. It was something she simply had to follow.
While I was in college, I didn't originally go in for nursing. And there was this moment where I was at the gym overlooking the pool, and there was a handicapped person being helped into the pool, and it hit me right then that what I was really missing in my life was helping people.
Personal reasons led Jean Marie to leave her vocation in recent years, but bureaucratic reasons now bar her from ever returning until she decides to vaccinate herself.
I think it was disheartening to hear many people, including some Supreme Court justices, discussing the fact that they feel that healthcare workers have no right to their own bodily autonomy.
Nationally, 81% of nurses and other healthcare workers are vaccinated, but President Biden's recent decree that staff in healthcare settings must all be vaccinated unless exempted is putting others, like Jean Marie, in further uncertainty.
This mandate imposes on top of an already historic workforce crisis that we're experiencing.
It is also putting their employers in similar positions as well. Kristen Knapp is with the Florida Healthcare Association. The massive staffing shortage in hospitals and nursing homes is well documented, but this mandate could further complicate a system that is already pinched, particularly in states where vaccination levels among staff are below 70%, like Montana, Ohio, and Missouri. For every infraction to the vaccine mandate, a healthcare setting risks its Medicare and Medicaid funding.
It's a challenging. I've been in this, I've been working in long-term care for almost 14 years, and I've never seen the workforce shortage and the workforce challenges like we're experiencing right now.
To relieve the stress on the system, some nursing homes are limiting admissions. In other cases, they're paying exorbitant prices to cover missing shifts. In some states, help is reaching nurses too. Since vaccination status is considered a controllable circumstance, most states won't offer unemployment to those who are let go because they refuse to get it. But 5 states have passed legislation that state otherwise, including Jean Marie's home state of Florida. The benefits, however, don't erase the subtext.
The real reason why I went into healthcare was to help people. And this ruling is basically saying, if you don't take this medical intervention, you can't help people.
To some, the idea of getting vaccinated to keep a job might be a no-brainer, but to others, not doing so is as core to their being as to why they chose this calling in the first place. I'm Dan Grossman.